Welcome, everybody, to another episode of Compliance Reality, where we discuss the reality of enforcement and compliance programs today. Today's topic is the routine waivers of copays, or routine copay waivers. We're just helping the patient out, right? Well, not always, and we're going to discuss that today. I am Dr. CJ Wolf, and I have over 22 years of full-time professional compliance experience working for organizations such as Intermountain Healthcare, University of Texas System, MD Anderson Cancer Center, and an international medical device company. I also hold university faculty appointments and teach, and I am a private compliance and coding consultant and trainer as well. You can see my certifications in professional coding, as well as healthcare compliance and ethics, as well as general compliance and ethics. And if you think we could help you with your compliance needs, please reach out to us at info@compliancereality.com. Let's start today with some enforcement cases regarding the routine waiver of copayments. This first one is a pain clinic that settled recently here in 2021, paying $1.6 million to settle allegations of False Claims Act and kickback violations. Specifically, this pain clinic, it was alleged that they caused affiliated surgery centers to waive copays for surgery facility fees, and this was inducing patients to get pain injections. Now, if you're just listening to the podcast, as always, we'll put the links and information in the show notes, and you can always also watch the video with the link. If you're just listening to the podcast, you can watch the video later. For this particular settlement, I dug a little deeper and found some information from the complaint in the court records. And as you can see here, these were some of the allegations. This was a whistleblower case, and the whistleblower was an employee who was asked to waive these copayments. And in paragraph 19 of the complaint, you can see it was alleged the realtor received an email from somebody who had been promoted to the assistant business office manager, and the email advised that all Medicare Advantage patients were only to be billed $100, with any remaining copay to be written off per Dr. So-and-so, who's the defendant here. It also is in the records here that an individual at the surgery center told the realtor that she was to record in the billing records that the waived copay was a quote-unquote courtesy adjustment, and that no discussion of financial need was mentioned by this person or anyone else. And the realtor did as she was instructed and entered courtesy adjustments for these patients. The realtor was specifically instructed that the most that any Medicare Advantage patient was to pay was $100 on such procedures, regardless of whether or not a financial need existed. So think about this. You have a doctor at a pain clinic who's, and the allegations are that this doctor was telling staff members at the surgery centers where the facility where the procedures were being done to waive these copays for the facility fees so that the patient would have more of these joint injections. These are the allegations. And usually when it comes to waived copayments, you also have allegations of medical necessity not being met because procedures are being done for financial reasons as opposed to medical necessity reasons. And those were a part of the allegations here as well. On this next slide, you can see just an example. This is labeled as patient one. Again, this comes from the complaint in the court records. You can see that a series of sacroiliac joint injections are being performed, and you can see that courtesy adjustments are being applied. $150 courtesy adjustment discount is being applied for each of these injections, and you can see that for this series of injections, the total billed amount was about $8,500, and the total amount of copays that were waived was about $1,200. Now, this pain clinic also, in addition to settling and making this financial payment of $1.6 million, also entered into a corporate integrity agreement with the OIG, and the integrity agreement has the standard type of compliance requirements that many of us are familiar with, but also provision that they hire on their own cost, of course, an independent review organization that's required to conduct audits and reviews of claims. And specifically from this corporate integrity agreement, it was the IRO needs to conduct a separate review of claims to determine whether all cost-sharing amounts, e.g. copayments, were collected or waived in accordance with applicable payer requirements. Now, we're going to get a little further in our discussion today. We're going to talk a little bit about when it may be appropriate to waive a copay, but the allegations in these enforcement cases are that they were being routinely waived without meeting these additional requirements when it may become appropriate, and that the waiving of these copays was a financial inducement to get patients to have these procedures done. The next example of enforcement is a Kentucky hospital that agreed to pay over $10 million to resolve allegations. And the allegations were that the hospital was submitting claims to Medicare resulting from improper remuneration in the form of free blood glucose testing supplies, as well as the waiver of copayments and deductibles for insulin. So, as most of these cases are, it's usually not just one issue that causes the potential problem, there's not just one allegation, there may be many. And in the resolution here, the press release, the enforcement agency said, of course, the settlement also resolves allegations that Jewish hospitals submitted claims to Medicare that resulted from improper remuneration provided to Medicare beneficiaries in the form of free blood glucose testing supplies and the waiver of copayments and deductibles for insulin, as I mentioned. Again, at the bottom of the slide, you have the link as well to this press release if you want to read a little bit more. The next enforcement example is from a DME provider or supplier, durable medical equipment, named Apria. This is a large DME supplier who agreed to pay a little over $40 million to settle these allegations. And the allegations here include a lot of different things, but the one that I wanted to hone in on because of the topic of this presentation is the copay waivers. The devices that were in question here were the renting and the use by patients of NIV equipment, which stands for non-invasive ventilator rentals. And as you can see here in the quote that I provided, Apria gave full copay waivers to hundreds of NIV patients without making an assessment as to whether those patients could have afforded some portion of their copay responsibilities. Again, this is a partial quote from this press release. But again, these are allegations that settle, and sometimes there are admissions of certain actions, but just want to make that clear for people who are listening, that these are typically settled as allegations. Now, the other allegations included in this were that managers from a number of the Apria branches directed salespeople to routinely discuss the availability of copay waivers with these NIV patients, these non-invasive ventilator patients, even before a patient raises any concerns about their ability to pay. They also allegedly offered copay waivers to persuade patients to rent from Apria instead of other DME suppliers. In addition to this settlement, it's outlined that this was brought to the attention of the enforcement agencies from 3 former employees of Apria who were the whistleblowers in this particular case. And the last enforcement case that I wanted to mention is a cardiologist who agreed to pay $2 million plus release his claim to another $5.3 million that was in suspended Medicare funds. So Medicare, partway through this investigation, I believe, suspended these funds and was not paying the physician. And so in addition to the physician paying $2 million, he also agreed to release any claim on this additional $5.3 million in these suspended Medicare funds. Again, these allegations were that there were medically unnecessary procedures performed by the cardiologist, and one of the ways that this was induced was that co-payments were routinely waived irrespective of the financial hardship that any individual patient may have had. This particular physician also agreed to a 3-year exclusion from participating in any federal healthcare program, so was excluded from Medicare, Medicaid, et cetera, TRICARE, for a 3-year time period. And the quote that I chose from this press release is from those involved in the enforcement said, by waiving the required co-payments indiscriminately, Dr. Kamar and ICE was the name of this practice, Institute of Cardiovascular Excellence, induced patients to agree to unnecessary and invasive procedures and other services. So wanted just to share with you these few enforcement cases that demonstrate that the waiver of co-payments is still an issue, even though there have been alerts and bulletins about this. This is not a new issue. It's been around for many, many years, but settlement cases are still happening. So let's jump into what some of those alerts and bulletins were or exist. They currently still are there. The OIG issued, this is one of the original special fraud alerts from many years ago, and stated that at first glance, it may appear that routine waiver of co-payments and deductibles helps Medicare beneficiaries. And a lot of people might think that, that's the title of the title slide that I put out there is, aren't we just helping the patient by waiving this copay? In some cases you may be, but that's really only appropriate when you have followed through and tried to collect and determine financial hardship and those sorts of things. The OIG said that in regards to this special fraud alert, that by waiving Medicare co-payments and deductibles, the provider of services may claim that the beneficiary incurs no costs. In fact, this is not true, according to them. Studies have shown that if patients are required to pay even a small portion of their care, they will be better healthcare consumers and select items or services because they are medically needed rather than simply because they are free. The OIG Special Fraud Alert goes on to talk about how in certain cases, a provider, a practitioner, supplier who routinely waives Medicare copays or deductibles could be held liable under the anti-kickback statute. As we all know, the statute makes it illegal to offer, pay, or solicit or receive anything of value as an inducement to generate business payable by Medicare or Medicaid. They go on to say when providers, practitioners, or suppliers forgive financial obligations for reasons other than genuine financial hardship of that particular patient, they may be unlawfully inducing the patient to purchase items or services from them. And then continuing on with this special fraud alert, one important exception. So now we're going to get into, there may be times when it's okay. One important exception to the prohibition against waiving copays and deductibles is that providers, etc., may forgive the copay in consideration of a particular patient's financial hardship. This hardship exception, however, must not be used routinely. It should be used occasionally to address the special financial needs of a particular patient. Except in such special cases, a good faith effort to collect deductibles and copays must be made. Now, that was from the special fraud alert, and now there's also a special advisory bulletin that was published about 20 years ago, August of 2002, about gifts and other inducement to beneficiaries. Now, this special advisory bulletin goes beyond just copays, but it does address copayments in some scenarios, so I wanted to tie this in as well. In this advisory bulletin, the OIG says, for example, even if a provider does not directly advertise or promote the availability of a benefit to beneficiaries, there may be indirect marketing or promotional efforts or informal channels of information dissemination, such as word of mouth, promotion by practitioners or patient support groups. So, even if it's not a blatant advertisement saying, look, we're going to waive copays, if it's routinely done, a support group, for example, for maybe cancer or some condition locally, a local support group, people might say, hey, did you hear that if you go to this hospital, they'll waive the Medicare copay? And so there's inducements there. Even if it's not a blatant advertisement, it could be these informal channels, word of mouth, and those sorts of things. They go on to, in this special advisory bulletin, to kind of highlight 6 suspect marketing practices that may be red flags if you're considering doing this. Think about these. Are there advertisements which state, quote, Medicare accepted as payment in full, or, quote, insurance accepted as payment in full, or, quote, no out-of-pocket expense. Those types of advertisements, may, if you dig a little deeper, it may turn out that, they're waiving copays or giving copay discounts without checking to see if there's a true financial hardship for a patient. Number 2 here, advertisements which promise that discounts will be given to Medicare beneficiaries. Third, the routine use of financial hardship forms which state that the beneficiary is unable to pay the coinsurance or deductible, and there is no good faith attempt to determine the beneficiary's actual financial conditions. Some people might say, well, okay, let's just, check the box and say we checked for financial hardship and everyone meets financial hardship. That might be a routine use of financial hardship forms. These hardship forms are maybe just filled out in mass and not individual particular patient determinations made to determine if there is true financial hardships. In most organizations, to meet financial hardships, you'll have some sort of application process where maybe there's an internal policy that says, patients at this income level or poverty level or this or that, certain criteria are made so that it can be used in a consistent manner and not, routine waiving of copays for inducement purposes, but rather a true process that's trying to identify if there's a true financial hardship. But don't fool yourself and say, okay, yeah, we'll fill out the financial hardship form to meet some sort of checkbox. If it's not a true and genuine good faith attempt to determine the beneficiary's actual financial condition, you're going to have a hard time arguing if you're just using these routinely. And then the numbers 4, 5, and 6, other suspect marketing practices, which is number 4, collection of copays and deductibles only where the beneficiary has Medicare supplemental insurance, such as Medigap coverage, like the items or services are free to the beneficiary. Number 5, charges to Medicare beneficiaries which are higher than those made to other persons for similar services and items, and the story here is the higher charges offset the waiver of the coinsurance. So you're charging the program more, but you're letting the patient off with kind of some sort of blanket waiver of the coinsurance. And then number 6, failure to collect copayments or deductibles for a specific group of Medicare patients for reasons unrelated to indigency. So, for example, a supplier waives coinsurance or deductible for all patients from a particular hospital in order to get referrals. And that waiver of the copay or deductibles is that inducement. So these were some suspect marketing practices outlined in that Special Advisory Bulletin. So basically, to summarize what we've talked about, we've shared some enforcement cases where waiver of copays and deductibles is still a problem. Many settlements still occurring, even though the OIG published many, many years ago their special fraud alert on this topic, as well as kind of a collateral bulletin, if you will, that it addresses it in some ways when they're talking about gifts and inducement to beneficiaries, and they drill down specifically on copays and deductibles. So these are still issues. You should be aware of them, and you should have compliance processes in place to make sure that these things aren't happening. Policies, procedures for determining hardship, maybe even do some auditing and monitoring to make sure that those in the business offices aren't doing these waivers. You could obviously check any waivers or copays and make sure that the accompanying financial hardship determination was followed according to policy, for example, won't be one way to go about auditing and monitoring. If you have questions about this topic or others, or you'd like to hear about other topics from us, please reach out to us at info@compliancereality.com. And if you need particular help with your compliance program, we hope that you please consider our consulting and training services. Again, reach out to us at info@compliancereality.com. Thanks for listening to another episode. We'll talk to you next time.